I felt like you spiritually came alive. And I want to ask what happened.
Well, I think learning to trust again, the fear, there was so much fear.
Yeah. I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform Protocol and how to transform your autoimmune disease naturally. If you haven't joined our Facebook group, make sure you join our Facebook group, Transform Autoimmune Disease Naturally, right now. Go ahead, go do it, where we have tons of lives and interviews and trainings that are bonus just for you. Go ahead and click the link and join. If you're watching on YouTube, make sure you subscribe. And if you're watching on Instagram, give us a follow and give us a holler. For those of you who want to learn more about us, you can go to drmaggie.com. Today, we have an interview of a mystery case. We had a huge mystery set of symptoms for 12 years in a young lady who's been destined to go into a career for acting, dancing, physicality, and was really stopped dead in her tracks with a lot of these symptoms. Find out how someone with POTS-like symptoms, neuropathy, asthma-like symptoms, pain, brain fog, tremors, how she was able to end this mystery case and completely turn her life around into a life of her dreams. Just you wait. Hey, Rachel, I'd love for you to introduce yourself to our audience.
I'm a student in West Virginia. I am studying mental health, clinical counseling.
Yay!
Yes. Before this program, I was actually in Atlanta pursuing my art dream as an actor and dancer. I really enjoyed being a fitness instructor and personal trainer as I was pursuing my dream. And then I got so sick, symptoms got so bad that I had to change the direction in life, which was okay. I do what I can to get through it, and I went back to school.
Let's talk about that. So you had a dream to be an actor, dancer, artist, pursue the degree and a profession in the arts.
Yeah.
And physical symptoms really brought that to a halt in a lot of ways. So can you tell me what those symptoms were? How long ago did this start?
They started about 12 years ago. That's when my journey began with the medical industry. My symptoms started off small and got worse and worse and worse.
What were those symptoms?
First, they started off with like minor things, asthma, allergies, gut issues, which led to severe gut infections, skin issues. Then things got worse, like kidney disease that came and went, neuropathy, and then the latest heart issues and tremors and spasms and things like that.
So it was more like some vague symptoms, allergic related symptoms, which is really common for a lot of people with autoimmunity. They'll start with allergic related symptoms, whether it's asthma, irritable bowel, food sensitivities, environmental allergies. That's really a common place to start. But then it really turned into more like physical symptoms. I mean, neuropathy is going to cause you a lot of pain, numbness, and coordination issues, right?
Oh, yeah.
How bad did it get for you right before you joined our program?
Severe, very severe. Going to the bathroom felt like I was dying. The blood pressure drops. I stopped exercising. The heart issues. I've had so many scares. It got so bad that I felt like a lost puppy in the world of medical, in the medical system.
What were your frustrations with the doctors that you were dealing with? Because I mean, so that our audience knows is that there is a happy ending to this, even in her medical story. So what was your frustration with all those doctors that you had seen for the last 12 years?
The biggest frustration for me was not so much that they didn't know, but was the dismissiveness and the wanting to accept it. Wanting me to accept that what was going on. Like one doctor told me that I needed to accept and stop running tests. I was called a Syndrome X patient. My symptoms were incidental, and these were from different specialists. So it was really, really frustrating. But I knew that there was a root cause. I knew to keep going.
And right before you joined this program, you met a wonderful podiatrist. Yes. See, there's a golden lining to this. a podiatrist. This is a foot specialist. Can you share that experience and how that led you here?
Well, he listened to me. First off, he cared enough to listen to me, because I'm going into these rooms, these doctors' the offices, and I'm showing them symptoms that are beyond their scope. I'm pressing on my belly and getting foot spasms.
Yep.
So, but instead of looking at me like, oh my goodness, whatever, he listened to me and really wanted to help me. And we kept doing tests, MRIs, which didn't show anything but bone spurs, but I was in severe pain, having these spasms, and he recommended you. And, I'm reaching for whatever I can at this point, whatever. And, functional, the word functional was in my realm. I was looking for a functional specialist around here, but I'm in West Virginia. And so he recommended you, and I took a leap of faith.
Well, there's more and more doctors out there that are starting to recognize that their approach is, their diagnostic skills are very limited in that sense, and tools for something that is systemic, that is a problem like autoimmunity. And I think he even mentioned to you, Rachel, there's a lot of inflammation or autoimmune issues. This is way bigger than this. You got to get a functional root cause approach to this. And this is the woman for you to see. I mean, he really sat you down and laid that down. And I am wowed and honored that more and more medical professionals are understanding this. Shout out to Dr. Michael Gentile.
Dr. Gentile, I'm glad you said it.
Out in West Virginia. You're amazing. Anybody who needs a podiatrist, go see that one, because that one's going to look at a bigger picture. But let's go back to, all right, so you entered the program. Pain was level what?
10.
10 out of 10. All right. And then you talked about the blood pressure drops. So these are POTS-like symptoms, blood pressure drops. How frequently were you getting these palpitations or fainting spells or nausea spells?
Every day.
So it's like an undiagnosed POTS. And that symptom was what, 10 out of 10 as well, correct? Okay. And what would you say your third biggest symptom was?
Chronic fatigue and brain fog. My gosh. The cold chills were so bad. The tremors, but the chronic fatigue and brain fog is what really was disruptive.
What level would you say it was?
10. 10. It's like the number went up as the day went on. So,
well, my question for you was, were you trying to go to school during this time, or was it only, because I know you're going to school now, and did that happen before you started the program or during the program that you decided to go back to school?
I decided to go back to school way before the program.
Yeah. So,
because that's what I do. It's like, okay, well, if something comes at me, what else? What do I need to do to, get through? And
so brain fog was going to be a big deal and an obstacle for you with schooling, advanced schooling for your mental health degree.
Oh yeah.
Okay. All right. Fast forward right now, 2 months later, you just finished the program. Can you share your results? Where are you at now? Just 2 months later. And everybody knows this is our program's it's a 2-month online program to basically launchpad you into a year of autoimmune turnaround. So these results are the early results. What are your early results just in the first 2 months? You finished our 2-month program. Where are you at 2 months?
Yes. Early results are huge. First off, I know this sounds laughable because I was a fitness trainer and an instructor, but I can feel my feet. So
wow.
It heals. So for anybody who's dealing with neuropathy, my gosh, this was huge for me. I'm walking differently. I feel differently. I could definitely say basic things like pooping, sleeping, and sweating. I didn't sweat.
Yeah.
Sleeping and sweating. And the brain fog and chronic fatigue has lifted. They both have lifted so much that I feel like I'm getting myself again. Whew.
Whew.
Months later.
These are your early results, and people are going to be, a lot of people are dumbfounded because out there in the world, 12 years of these type of symptoms, nobody gets in 2 months have complete reversal of fatigue, brain fog, neuropathy, POTS symptoms, to name a few. So people are going to want to know, What do you think is so different about this program? What have you done in the last 2 months is so different than everything that you've done the previous 12 years before? Why did this get results? Why did this work?
Because I know why. First off, what was behind everything. I know what were the causes, the main causes, and I know now what to do. That's the difference. The education in this program gave me the ability to be proactive about it.
You know, Rachel, what resonated with me most in just really getting to know you really well the last 2 months is that I felt like you spiritually came alive. And I want to ask what happened.
Well, I think learning to trust again, the fear, there was so much fear.
Yeah.
Because I didn't know. Now there's so much hope, and I know, and the results so far, it's been very transformative for me.
What was something you learned about yourself that surprised you?
Honestly, how resilient,
Mm.
how strong.
Yeah.
Also, there definitely is. I learned more about my own family and my mother who's passed. So that learning more about that helped me learn more about myself.
Why do you think you almost didn't join this program? Or was that even a consideration for you?
Oh gosh, yeah, I almost didn't join because first off, it was hard to trust anybody at this point. There's so many gurus and experts out there. It almost seemed too good to be true. So that is why it took a leap for me, a gut instinct.
Can you expand upon too good to be true? Because I hear this, right?
Well, first off, you said, I'll never forget the first phone call we had. You said you ate my symptoms for breakfast and that I would be better in 2 months. And so here I am. I feel like I'm dying. And you tell me you eat my symptoms for breakfast.
I did. And mind you, I wasn't supposed to be on the phone that day. That's the other thing. Right. I'm not usually on the phone, but we had a actual big hurricane, some problems with the person who's supposed to be on the call with you, was Anna. And I said, I will take her phone call. And so that's serendipitous right there, because I am not on the phone normally. But I think I kind of almost laughed a little bit at your symptoms. And I was like, yeah, those are the kind of symptoms I eat for breakfast. On a scale of 0 to 10, that's like a level 2 for me, girlfriend.
Yeah. That was like, okay, no, I don't know about this. So, and I didn't know if I was ready for it because I did feel so beaten down. Yeah. And you have this intense energy, and you do, and I was like, I don't know if I'm ready for this, but I mean, when it's your life, it's my life. I'm willing to do whatever, and like I said, it was a leap of faith and a gut instinct. And I put some things together and did it.
Well, and now that you're at the other end of this, you've been through this program. I mean, what I said was, on a scale of 0 to 10, 10 being the hardest problem we deal with, these are like level 2, 3 problems for us. And these are the kind of symptoms I eat for breakfast. Some of the symptoms we get the quickest turnaround in. You've been through the program. Did any of what I say not ring true? I'm honestly.
No, I mean, nothing you said. There was nothing you said that didn't ring true.
Proven to be true.
Proven to be true. Yeah, it's, I mean, you were right.
Can you say that again?
You were right. You're right. You literally, you ate my symptoms for breakfast.
What would you say to a Rachel out there right now that has not done this program and they're watching this video of you? What would you say to them right now?
I would say, I know you're scared. I know it feels hopeless and helpless. Trust, just trust, and do this program. You won't regret it. You don't have to suffer. You don't have to You don't have to live life like that. It doesn't have to be like that.
I'm so proud of you.
I'm proud of me too, honestly.
I'm excited for you to see what turns out for you with schooling, and happy to see that your improvements are going to continue. This is literally the tip of the iceberg, Rachel.
Yeah. Thank you so much. I am so excited too. I'm so grateful. So grateful.
Thank you for sharing all this with me and with our audience. I'm sure there's going to be many Rachels out there who are going to hear you today.
You're so welcome.
Thank you for that amazing share, Rachel. Going 12 years with POTS-like symptoms, nausea, dizziness, tremors, feet pain, physical pain, palpitations, anxiety, irritable bowel stuff, asthma and allergies is not fun, especially when you're being dismissed by your physicians. How many of you out there feel like you're being dismissed by your physicians and you're a diagnostic conundrum from them, and they're starting to tell you that it's all in your head? If that's you, go ahead and give us a thumbs up and a heart. Give us a follow here. If that's someone you know, write their name in the comment section right now so that they can see this video, because they may not listen to you, they may not listen to me, but they might listen to Rachel. So it's Rachel's goal and my goal to raise awareness. And if you can share and raise that awareness, that'd be amazing. And if you haven't joined our Facebook group, make sure you click the link and join our Facebook group, Transform Autoimmune Disease Naturally. And I'll see you in the group.